You're welcome to today's lecture on AM 221 Actions and Uses of Medicines 1. In our last lectures, we introduced factors that modify the dose and effects of drugs, and we outlined them, after which we picked the one after the other. The last one we treated, we are still on the physiological factors. We entered the age, how age affects the dose and effects of what drugs, and I gave you some formulas for calculation of what dose of drugs based on the body surface area as well as the body weight, especially for children. So I told you that we do the actual calculation in the pharmaceutical calculations. So we conclude from where we stopped. Generally, for newborns, drug dosage for newborn is decreased. You decrease the dose for newborn for the following reasons. The first one is that for newborns, the gastric acid secretion is not adequate. They don't have adequate gastric acid secretion. Of course, you know the effect of gastric acid on drugs and foods. So now, again, what happens in food to drug now? If these drugs, if this drug is not acted upon well by this gastric acid, there will be no what? Absorption will do what? Will do what? Decrease. Am I sorry? Absorption will be what? More. And if the absorption is more for some drug, what it implies that it may lead to what? Over what dosage. The one that will appear in the systemic circulation will be more, even more than the therapeutic dose. And it's a very big problem for some drugs like ampicillin. In fact, penicillins, ampicillin, amoxicillin. So in neonates, because of this decreased acid activity in neonates, there will be what? Greater absorption of this. Now even offshoot the above the therapeutic dose for such a newborn, and is an issue. Unlike in adult where you have an adequate gastric acid secretion, such may not happen. Then at the same time, in the liver, I think we discussed this about. I did an assignment about gray baby syndrome. Who searched for it? I told you to look for what is gray baby syndrome? How is it linked to chloramphenicol? You not do it. Okay. Let's continue. So now you know what happens in the liver. These microsomal enzymes. You know these drugs are metabolized in the liver. So if these drugs are not metabolized, there will be in fact, their half-life will be increase. At the same time, not just that, there will be accumulation of this drug. I'm not communicating. So in case of chloramphenicol, it leads to gray baby syndrome. I told you to look for it, but I will not tell you that is what is gray baby syndrome. That is not that is not division. That is not baby syndrome. There are a lot of other issues that happen to new baby. Three of us. They should what makes it gray baby syndrome. That's what I want to hear. Not. Please, if you are giving an assignment, do the assignment. There's a reason for that. There are other issues with newborn that can be fatal. So that is not peculiar to gray baby syndrome alone. That's why I can't take it as it. You're just repeating what I said now. Am I communicating? They have the deficiency in liver microsomal enzymes, especially the one that is involved in, especially for chloramphenicol. There's one time we mentioned here. What is that? Gluco glucuronidation, right? And we mentioned the enzyme that is involved in that, glucuronate what? Transferase, that is involved in this glucuronidation. And if this is deficient, this will not take place, or it will take place halfway, and what will it will result in accumulation of what? Chloramphenicol, leading to what? Grade B. I will not tell you this. Find out what grade B syndrome is. So the next point I want to make, if go assignment, don't come here and be reading what you open here. If I want you to read something, yeah, you read it for me. I say do this as assignment, not opening your Google and be reading what you don't know. That's not assignment. If we are in a class, I want you to check off something, I'll ask you check it off. But this one, I gave you as an assignment. Do it, we discuss it, and nobody did it. Let's continue. Yeah, good morning. So let's continue. So now, another issue that in neonate or newborn, there's this plasma protein binding is what? Less. So there will be more free drug in the what? Circulation, and it's not a good thing. Am I communicating? So then for the kidney, their kidney is not yet what? That fully what? Fully what? Developed. So they have issue with what? Glomerular filtration rates. At the same time, tubular secretion will also be what? Inadequate. So the kidney will not filter, the rate at which it filter will not be what? Adequate. At the same time, there will be what? Inadequate what? Tubular what? Secretion. So if the dose of this drug is not reduced, they will accumulate. You know that the kidney removes what? Removes these xenobiotics. Drugs are what? Xenobiotics that are foreign to the body. The kidney has a way of do what? Excreting them. But if when they are done with their work after metabolism and other things, but if they are not excreted, removed from the system, they accumulate. So that's why for children, you tamper the dose, bring down the dose so that it will not accumulate in the system and become, of course, it's toxic and become toxic to the baby's system. So have you now seen the reason why age for a child you tamper the dose so as to do what? Achieve your purpose. Are we together? Now, there's what is called blood-brain barrier in the central nervous system. That's what is called blood-brain barrier. Any issue? Here is that now. Is that what? I know. So where did I stop? I said that in the central nervous system, there's what is called what? Blood-brain barrier. Now, you know that the drug you take or you administer pass through the systemic circulation. Now, there is this tendency that because the child for a neonate, this barrier is not yet fully developed, separating the secretory system and the central nervous system are not completely that this separation is not fully defined as in mature individuals. Now, there is tendency for this sort of drugs to cross that what blood-brain what barrier. That's why even some stimulants that may not have much effect in adults, once it has enters the system of a newborn, it will definitely cross the blood brain barrier, and it can affect the CNS. Am I communicating? The central nervous system. So they can easily get call it let me ask a question. If something stimulates the central nervous system, or if a drug has a way of entering the central nervous system, what symptoms what common symptoms do you notice that will happen? The person will become what? Not necessarily. Even as a side effect of some drugs. Feeling what? No. Huh? Not nausea. Anyway, it was in some instances anyway, but that's the commonest one. Huh? Tiredness. Very common. You started doing what? Am I communicating? Most drugs that you take, you start feeling what? Drowsy. You want to just stay one place and sleep off. The central nervous system is involved now. Am I communicating? The brain, central nervous system is fully involved. So to avoid such crossing the blood-brain barrier, you either avoid such drug, or if that drug is very important that you must use it, look at the dose. Am I communicating? Look at the what? The dose. Have you now seen how effects of a drug is affected by the age? No, in an adult that has a distinguished, the blood-brain barrier is there. It may not, the adult may not, the effect may not be as it is in what? Newborn, because their own is not yet what? Fully what? Developed or separated. So there is immaturity of blood-brain what? Barrier in what? Neonates. Yeah. Example of what? You came now, right? And you asked me a question. If you come late to my class, you have no right to ask me any question. You have lost your right to ask question in my class. If you come late, just keep quiet. That's the punishment for coming late to my class. Then if that one is not working, I'll stop you from entering entirely. If you can't learn a lesson from that, then I'll stop you from entering entirely. I started from talking about central nervous system here, right? Talking about the systemic what circulation. Because she came late, she asking me types of blood-brain barrier, the examples of blood-brain barrier. Because she came late. Please take your lecture seriously, no matter what. Okay, now for children, children don't take what tetra what cycling. It causes what? Permanent what? Teeth what? Staining. Permanent teeth what? Stain. That's major reason why they don't give them what? Major reason anyway. Tetracycline. Even corticosteroids, try to avoid them. Remember, we're talking about factors modifying the dose and what? Effects. So age can modify effect of a drug. This issue of stimulating crossing the blood-brain barrier and having effect in the central nervous system, because of the age of the neonate, not the barrier not fully what developed, you see the effect. But if the same drug is administered, if an adult uses the same drug, it may not be, the effect will not be as much as you see in what, in a neonate, just because of the age what different, because of the immaturity of this what barrier. Am I communicating? Good. Now, so the same thing, adult, we take tetracycline, our teeth nothing, but if they take it, you see now what happens, stay permanent what stain of what teeth. So the effect, difference in effect is because of the age. Then the same thing, corticosteroids, we mentioned a lot of examples of corticosteroids here. I don't even write what I'm teaching. So we gave different examples of corticosteroids. And what are they? Number one, I will not tell you this one again. And number one is what? I'm listening. Hello? Everywhere is not silent. Please go and study. I can't keep repeating myself here every day. It's not a good sign at all. It's not. So, corticosteroids may lead to what? Growth and what? Development retardation in children. Growth and development what? Retardation. So you know how you give what? You administer what? Corticosteroids in them, in children. That's the point. In fact, there are other drugs you can use that are not even what? Corticosteroids and achieve your what? Purpose. Then on the normal, antihistamines, especially those that have central effects. An example of antihistamines is something like chlorpheniramine is an example of what? Antihistamine. What are you writing? What are you writing? Since I'll stop giving you handouts ahead of time, it's taking your attention in class. I'm talking, you're writing. What do you know you're writing? No, you are writing, you are copying your handouts in your note. What are you looking at in your phone? Spelling of what? Okay, what did I say last? I have to tell me now. Please keep that to your phone. If there's a spelling you don't ask me, I'll write the spelling on the board. Keep that to your phone. It distracts. The material you already have is your own. If you are in class, hold your pen and your writing material. I'm watching your lecturer speaking. When you go to your hostel, you do what? You look at your watch, the one you have in your phone or handout you have already. Once the lecturer is here speaking, just listen. There are some things you can pick up from what he's saying that is not even in the what material. I don't know how many times I will say this. So I said that on the normal, we have the example of antihistamines. We have here chlorpheniramine, the brand name we call Piriton. Chlorpheniramine. An example of this is Piriton. That is the brand name. The commonest brand of it is what? Piriton. So this one, if you have it in tablet and you what? Syrup. This one now can cause what? can make you to feel what? Drowsy. Not in everybody anyway, but most people will feel what? Drowsy, because this one has central what? It has more central effects, CNS effect. That's why you feel what? Drowsy. Am I communicating? Now, in fact, it's even advised that you don't take it and drive, because you start feeling what? There are many of them, but this is just one of them. Now, if an adult will take it and be, now what will happen to children? In fact, some parents even abuse it. If their children disturb them too much, they go and give them the so they will sleep. Yes, some do it. I say, can you all go? They will carry this and give to the baby. The baby will sleep, because the effect in the CNS for that age is more. Am I communicating? It's more. They just sleep off. To compare with what? Adults. You see what the age difference can do. The effect will be more in children to compare with what? Adults. Anyway, there are some of them that doesn't have any much, have that don't have that central, something like loratadine. Loratadine is an example of this antihistamine. This one does not cause what? This what? Drowsiness. We have this one as 4 milligram tablets. This one is commonest one is 10 milligram tablets. Now, what point am I trying to make? I'm trying to point out that the effect will be more in what? Children than in what? Adults. So this will guide you on how to work on the dose if it is necessary to give. Am I communicating? If it is what? Necessary to give. You have to give, but know that this will change the dose for such children. That's why an adult can take 4 milligram of this. You start seeing children can take as small as 2 milligram in in syrup form, maybe with 1 milligram per 5 mil or 2 milligram per 5 mil, depending. So as to do what? If you give this 4 milligram, they will sleep like not like no other, and the side effect will be more. So that's for children. So you have to work on the dose to be able to do what? Accommodate this point I have listed. Now, what of geriatric patients? Remember, geriatric is 60 and what? Above. Remember that, right? In our first class, we listed different age what? From neonates to infants, infant to what? Child, younger child, older child to adolescents to adult to elderly. So anything between anything from 60 and above is elderly, geriatric patient, right? And then anything below 18 down, from 18 to 60, between 18 and 60, adult, right? So now we are talking about what? Geriatric what? Patient. Then anything from 17 down is what? So geriatric patients is above what? 60, right? Above what? The strength will start going down until the person get old and die. So when they want to die, they just go and lie down and die. That one is natural. That one is just natural. They get old, just go and do what? Lie down and do what? After night prayer, lie down and do what? Die. cause. But drug adults, I've seen cases like that. In fact, they know that they are dying. It's not even, they just grow old. Some get up to like something years, 100 and something years. The day they will die, they will just lie down and do what? Die. So this is the cause. This is how, if you plot it as a graph, this is what will happen. So from here now, a lot of the organs in the system is becoming weak. They keep going down. They keep going down. They keep going down. The kidney will not be as strong as when the person was at this age. The liver will not be as strong as when the person was at this age. So at this point now, the dosing will be almost at the same time as dosing here. Here. Am I communicating? Because here the system, these organs are not fully what? Blood-brain barrier is not yet strong. The liver is not as strong. Most of the microsomal enzymes are not even sufficient enough. The kidney is not that fully developed. You will have to temper with those to avoid, because drugs are xenobiotics. Once you pump them like that, they will not be able to metabolize well. In fact, even plasma protein will not be, you did your pharmacokinetics in your first year, right? We are told anything about plasma proteins, binding of drugs, doing distribution. We are told that the effect of plasma proteins. So thank you, since that makes the work easier for me. Let me now go straight to the point. Now, these plasma proteins are not sufficient enough. They are not fully what to. So you have, if you don't consider the dosing, you have a lot of free what drugs in the entire system, and it's a problem. The same thing if the kidney is not fully developed and you pump these xenobiotics, they will not find a way to leave the system. But since they are xenobiotics, they are supposed to leave the system. If they are done with their job, they will do what? They will leave. They are not biodegradable. They are not biological. They are xenobiotics. They are foreign things. So once they enter the system, do their work, they should leave. It's not as if they will remain there, then the body will now convert them to something else that will now nourish the body, and no, they must leave. That's why they need to be excreted. If not, they become toxic in the system. So that the kidney that is supposed to do what? Eliminate these things or clear them from the system is not fully mature to do that. So why are you pumping? You consider the what? The dose you are doing what? You give, if you must administer that drug. The same thing that happens here. When the whole thing is weak, you also consider the dosing too. Am I communicating? So what really happened in geriatric what? Patients? A lot of physiological changes occur in geriatric what? Patients. So they are special patients anyway. Things like you see reduction of weights, reduced body weights. That hefty giant, you know, you see, who among you have seen your daddy's picture when he was, let's say, 30, 40 years? If you see his picture then, giant like this. Maybe if he, maybe let me say you are grandpa. If you see him now, three of us, so everything is going down. So the body weight, everything is going down. Remember, those has a lot to do with the body weight. Remember when we discussed those formulas I gave you. Body weight is important too. Now, you cannot be giving the person the dose you are giving the person when he was taking at this point. You are injuring that patient. You are not helping the patient. Am I communicating? So the body weight will reduce. So you have to look at the dose. Then even the body fats will reduce. Maybe he used to be like this. Everything will now shrink. You will see what is called shrinking. The body, everything will just shrink. It's also what you consider again in dosing. Then even the mesenteric blood flow, all this blood flow from the portal to the systemic circulation, all those blood flow, even the intestinal motility, the movement will not be the same thing again. It will do what? It will look as if everything will go down back to what? Look as if they are what? Children again. That's why some will tell you, please now know how you handle these elderly people. You know they are like children. Has anybody made such statement around you? Please handle them, and I don't expect them to start reasoning the way. Stop seeing them as adults. If you know how you take care of children, take care of them like that, because they are getting what? They are old. So the same thing, everything in the system will start what? Going. So the dose should also do what? Come down. So the intestinal motility and mesenteric blood flow will also do what? Reduce. Even the renal, that is the kidney, and the hepatic function, liver, will also do what? So you must work on the dose. If not, you are killing the patient instead of doing what? Helping to take care of the what? The issue the patient has. So even mental, the central nervous system, the brain, mental, not just within general mental function will do what? If care is not taken, if you don't understand what is happening, you start saying that the grandma is running. No, is things are changing. Everything is going down. So following this was plot. That's the peak. When he was, if you want to jump, you can jump from where? That's the prime. But now, maybe when you were coming up, can call you. If you want to run, you run. You carry it. You test you, frog you, do. But you just looking at it because the strength is no longer there. So a lot of things are going down. So you have to work on the what? The dosing. Very important. And apart from that, now there is this tendency for them to experience more adverse what? Reaction. So these are reasons why you should look at the what? Why they work on the what? The dose. Because of even the GIT is going down. So it is even preferable giving them drug in what? Liquid what? Dosage forms than what? Even solid what? Dosage form. Just like children. Remember, we are discussing factors modifying the what? The dose and what? Effect of what? Drugs. We are still talking about age. That one is detailed. There are a lot of things to discuss in age because there are different age brackets. That's why it's taking this time. Are we together? Yes. So because the liver function is impaired, some drugs, remember I keep telling you about drugs with narrow therapeutic window or therapeutic index, meaning that the gap between the therapeutic dose and the leather dose or toxic dose is just small. Things like diazepam, theophylline, even digozide, the many of them. These drugs, they have what is called diazepam, they have narrow therapeutic window. They have this drug, they have narrow therapeutic window. Specifically, this diazepam and theophylline specifically, these things, they have, three of them, they have narrow therapeutic window, but my focus is on this and this. Diazepam and theophylline, in fact, their half-life, we already taught half-life. Yes. So what is half-life? When everybody is speaking, so if you know, you raise your hand and tell us what half-life is. What is half-life of a drug? Nobody want to talk here. So seriously, there's something happening in this case I don't understand. Please, I need to understand it. You ask a question, some fighting. It's not this one, it's not this one, it's this one. No, when you now ask, okay, one person should talk, you don't hear anything again. I don't understand it seriously. Please, who can tell us what half-life is? Please. What is half-life of a drug? If you know, you stand up and tell us, please. Be bold. Have confidence in yourself. Tell us. It's the time required for a plasma concentration to reach 50% high after administration. Okay. Okay. That is 50% gone, right? 50% actually it means 50% to what? Gone. Hope you know. Now, the half-life of this drugs on a normal is 2 hours on a normal. But in elderly, in geriatric patient, it can get up to 90 hours. Is that not a problem? These are xeno biotics. Remember, they are xeno biotics. They are foreign to the system. Now, you see how harmful, how do I put it? Call it toxicity, whatever I call it. It will be to the system for it to remain in the system for like 90 hours. It can stay up, the half-life can increase up to 90 hours. What is 2 hours on a normal? But in elderly, so you need to look at the what? Dosing. Very important. So that even if you stay in 90, at least the one that will appear in the system will not be that much to cause much what? Issues. Am I communicating? So these are the reasons why you do what? Dosage what? Adjustment. We call it what? Dosage what? Adjustment. Now, then even in kidney, the kidney function is also impaired. You see drugs like this bigozine, lithium, aminoglycoside. Okay, you do this your second year MCB 211. You do. Have you started antibiotics? Classes of antibiotics. Okay, you've not. Don't worry. When you do it now, you appreciate it. So, aminoglycosides is a class of antibiotics. Lithium, digoxin. So, in elderly, because of the impaired renal function in the elderly, excretion of this is what decreased. I just gave some examples, not only this one, but the excretion is what decreased, and it causes what issues. It causes what issues. Now, the same thing happens to protein binding. Thank God you said that you discussed plasma proteins in your pharmacokinetics. Now, the plasma protein binding of this drug will be what? Reduced. And have more of free drug in the what? Circulation. And it's a problem too. So the amount of active drugs in the system will more, and it's a problem. You know, the body doesn't tolerate anything foreign to even stay for a long time. Do your work and do what? Go. Or go and hide somewhere. Don't be blocking us, be parabolating here in the system. Is issue for the body. Am I communicating? Good. Now, so drugs that depresses the CNS, the central nervous system, things like diazepam, morphine. In such patient, just the same thing that happen in children. In such patient, there's increased sensitivity to these CNS what? Depressants. So, if you have an elderly patient, maybe your grandmother, your great grandmother, or your grandmother or father, maybe getting towards 97, 90, 80, another time, maybe the patient has BP. Maybe he now high blood pressure. Maybe he is now used to that one they call ogola. Some even think that things like even um, name them uh, Yeah. Tell me. Example of them is what? Huh? Huh? Laura? Broma? Broma? Zepam? Broma Zepam? Brome? Is it Broma Broma? Brome? Brome Zepam? Or Broma Zepam? Which one? So be careful. Doctors may prescribe. After that first time the doctor prescribe for them, they'll start prescribing it for themselves. If you see yourself tomorrow, you are working in a pharmacy, please, or you have your own, be careful. Be careful. These things should, in fact, these drugs, these things are not what you just give anyhow. It should come with a prescription. It should be in poison cupboard. There's what you call poison cupboard, and there's be what you call poison book. If a doctor prescribe it, you collect that prescription from the patient, put it in this poison, record it. It's not what people just walk in. It's beyond ordinary. Just we have over-the-counter drug (OTC). We have prescription-only medicine. Then this one is not just beyond that prescription. It should be in poison. It has a cupboard on its own where it should be. It's not what you just display on the what? Display on the time, sir. Eh? You hear them by 8:30, right? Okay. Let me round up. Okay, 8:30, yeah? Yes. Let me round up. So, it's not what you just display anyhow. You have to do what. So, if anything happens, we things happen here, we go scot-free. You think that maybe nothing happened. You think you're the it's when something happened that way you know what you have brought upon yourself. You come and take and give me, you give, but the person will go and take. Some will sleep from there, they will just and go. Then you now be asked who prescribed. You say he came, she came, and I gave. Who, how? So please, let's be careful when we get there. So the point I'm making is that in elderly, the effect is more in such patients, unlike in adults. Am I communicating? In elderly, the effect is much. So as you're giving elderly, one day he may take and sleep off and go to meet his ancestors. Then you will explain tire, no evidence. You will explain tire, no what? Evidence. So just let's note that. So there is increased sensitivity of CNS what? Depressants. Are we together? Are they only CNS depressant or antidepressant? Which one? Diazepam. Razepam. Are they the depressant or antidepressant? Are you sure? Are they depressant or antidepressant? I know you have not done it too. I know. I'm just trying to, make you. I want to spike, ignite your this thing, your quest for knowledge. But are they only depressant or antidepressant? You still do it. There's a palm a depressant or antidepressant? Depressant. Cynthia, have you seen it? Is it depressant or antidepressant? That's the palm. Check. Diazepam, lorazepam, bromazepam, nitrazepam. Others to check now. Is it only Cynthia check? Huh? Huh? Is what? Read what you read what you got there. Read what you got there now. How do you know that is a person? Oh, you are just saying the person without even. Uh-huh. You say what?
That it slows down the activity of the brain,
Okay.
leading to calming and relaxing effects.
It slows down what? Activity of the brain.
Showing anti-anxiety.
Which one? Is that what they are what? Which one? Wait. This is becoming interesting. She said that diazepam is depressant.
No, it's
Okay, you said that it's antidepressant, and she said that it's a depressant. Which sources are you putting in? Stephanie, is that a antidepressant is it a CNS depressant or antidepressant? Which one? Depressant. Read your material well now. Let's hear you. In our go put it with confidence. Stand up and read. Let me see what you got.
a neurotransmitter that inhibits brain activity, leading to a depressive effect on the CNS.
Is that why you said that it's a depressant? Huh? Okay, Google is that the palm a depressant?
This is for depression.
Hmm? Hmm? Ngwa, Kifu, go on, Kifu. This is becoming interesting. I love this. Ngwa, Kifu, go on. Okay. Tell me, what did you see? Hey, let's listen to Onyi. Uh-huh.
Diazepam is a depressant. It belongs to a class of medications called benzodiazepines.
It's a depressant. Ngwa, here, Adaya, you read your own. Read now. Uh-huh.
Diazepam was a significantly better antidepressant. It was.
If I can get it. Okay, you Listen,
Benzodiazepines such as diazepam, clonazepam, and the rest are sometimes prescribed to treat anxiety, acute stress reactions, and panic attacks.
Okay.
So I think it's present.
But wait, what, Ada? Please, what is your soul? I'm confused. Okay. Listen. Is that what? Is that what? It was what? Okay, it was antidepressant. Okay, now it's not antidepressant. After this, hello, after these few minutes of dragging now, you can never in your life, anyway they mention diazepam, you have something to say. Enter the mention because the you have something to contribute. That's the idea. We have not concluded though. We have not concluded though. So we have two opinions now. Hello? We have two opinions now. We have two lines of thoughts. So we want to know which are which. I want you to do more consultation on this. Get textbooks. Find out. You have your pharmacology textbook, right? You bought it, right? Okay, it's in your cupboard, right? Resting, child. Some of you have not dusted it, right? This is time to dust it now. Hello? Go and dust it now. Look for, go to index. If you don't know how to search it, just go for index. Go to your index. Look for either diazepam, either bromazepam. Just if you see any of them, then open that page. Check whether whether what class they belong to. Are they CNS depressant or are they antidepressants? So what are now antidepressants? What are now antidepressants? Okay. What are antidepressants?
They are the medications that increase or enhance the activities of certain neurotransmitters.
Example now. She made a point now. Neurotransmitter. Example. There are under that antidepressant, there are different classes. So I don't want to go into that, but just tell me. Example. We have what? So what are these antidepressants? What are they actually? You know that what is depression? What you remember? So I think I'm talking to you.
Here, see that antidepressants are a class of medication used to treat major depressive disorder and anxiety disorder.
Bam.
I went to YouTube and YouTube put that is the time also used to treat anxiety disorder.
Listen to her, please. Anti what? Depressant. For depression, okay?
Depression and other mood disorders,
Mood.
such as anxiety disorder,
Okay.
obsessive compulsive disorder,
Okay.
and sometimes chronic pain condition.
Yes.
Then, unlike depressants, which slows down brain activity,
Yes.
antidepressants works to balance.
Okay. So, did you get example?
There's many examples I cannot mention. I don't know how to pronounce it.
Try. Stand up, try. No, just try. I'll help you.
Fluoxetine.
Hello, listen. Another one. Sertraline. Escitalopram. Okay. This one are what? Anti what? Okay. What are the example of depressant income? Okay. I know I'm doing this. Okay. Generally, their class, the class is what? Benzodiazepines. That's why you start seeing diazepam. What? Laura? Laura, right? Good. I think I mentioned it here, right? Another one is what? Apra, okay. Aprazolam. Another one? Bromazepam, Adepia. Huh? You said what? Morphine? Morphine, good. God bless you. And what? Now listen carefully. Listen carefully. These ones are what? Antidepressants. These are what? Depressants. Now listen. Listen. You know, there's something someone meant. You see where the confusion came from. You know, there are some when only somebody that have even disorder, mood disorder. It can be bipolar disorder. It can be most of them, most of them have this some of them have this depression. Am I communicating? See, depression is dangerous. You see, depression is dangerous. Please, if you see somebody passing through that depression, that person needs help. It's a serious problem. Especially when you see yourself, you want to kill yourself. Kill, jump. As you are passing through it, jump. If you see knife, you start hearing kill, stab, cut yourself. If you see gravia, that is anything you are doing. Please try as much as possible to find happiness. It's not easy, even if there's no happiness. Find happiness. Be intentionally happy. Yeah, intentionally be happy. Intentionally, not allow anybody to make you happy. Try to generate the happiness by yourself. It's very important because people go working on. So if your happiness if you hang your happiness around the neck of people, you are gone. You passing through depression almost every time. So please, in everything you are doing, this is not the class, but I just want to say it. It's not a good thing. And that's why the suicidal this thing now in our set now is on the high side. Depression. Be very bad. So we still do it as a topic. I think so. Yeah, but it's not. This is not the crowd. I just mentioned it because I just want to open your eyes a bit because this can be confusing. I was talking about CNS depressant. I mentioned diazepam, morphine. Look at them here, right? And I mentioned others, bromazepam. So it came to my mind to antidepressant. I decided to push to you. Let me see what you can get from it. Am I communicating? So please, this one are under, anxiety. You can also call this that anti-anxiety. Anxiety and depression are the same thing. If you're anxious of something, am I communicating? Yeah. This has a way of what? Depressing the what? Oga, calm down. Oga, just calm down. Okay? Just calm down. Just go and sleep a bit. That's why most of them has this tendency of making you to go and do what? Sleep. Most of them, except the new one. I think this is citalopram. This one here, even though it's this one here are anti what? The depressants. These ones here, let me not go into this, but I was trying to make a point on this. Things like this, diazepam, lorazepam, bromazepam. They want you to take it to calm you down, and this tendency to do what? Sleep is also what? There. The reason that some people now start seeing it as BP drug. In fact, they call it what? Without knowing that it are no business. It are no direct business with what? Reducing high what? Blood pressure. Yes, if you are calm and sleep, it may come down. True of us. Yeah, but it's not a direct thing. It's not a direct what? Thing. So let us not talk much on that. This is not the topic we are treating, but I just want us to. So by the time you start it, you will do it in class now. I believe you know you have something to say. Hey, so I want you to study, please study. Have you seen why I come here every day to ensure that the foundation is strong in this course? That's my mission, to ensure that the what foundation is what strong. You see how long it took us to just discuss one or two things. But I believe that if they call you tomorrow on these things we discuss now, you have something to do what? To say. That is, if you keep encouraging me. If you discourage me, I am Maya KCMia. I am Maya KCMia. This thing you are doing, if you wait for me to come before you, if you continue like that, I will stop. I'll stop coming on my normal timetable. We just come. Pia. We discuss it. And is that what you want? Okay, some say yes. Okay. What am I saying? I'm driving I am driving to somewhere. Please, the point I'm making is that please take this lecture seriously. Stop showing me this expression. This expression, sir, I'm tired, sir, you're disturbing us. Huh? Don't show me that expression. Do you know why? If you show me listen carefully. Madam, I am saying in your class, please. If you show me that expression, do you know what it make me feel? It make me feel as if I'm truly stressing you, and I will start pitying you. And when I start pitying you, I will stop coming. I'm coming only once a week as per timetable because I'll start feeling for you. So don't make me to start feeling for you. And you know the effect of what feeling for you can cause. So please, I beg you. I leave my house. I leave my house and come here. I should be sleeping. Sleep and wake up, prepare myself well before coming to work. But see me, 7 that I'm here. Check it now. Have you ever asked yourself that question? This man is always here before 7:30 is here for you. Then you are hosting doing what you don't know. It's your business. Listen, it's your business. Sort it out with wherever you're coming from. Am I communicating? Sort it out with wherever you're coming from. When it's time to, if you reach where you should talk, you do what? You talk. Before I fix this time, I ask questions. When did this happen? I was told I fix this time. So don't even do it. Then we talk. Keep talking. You keep talking. This is where you should talk. You keep doing what? You keep talking. You keep talking. Huh? You say what? Alright, so I think we'll stop here for today. Please, I want you to study this thing. Please research on this gray baby. I keep saying this now. Research on gray baby syndrome. What it actually means. I'm not just what does it actually mean? and what are the symptoms. If you are asked about a particular reason, what to check out is first of all what causes it. Second, what are the what signs and symptoms. These are what you, because there's something that distinguishes from others. Find out what that thing those things are. Then if possible, how to avoid it, or how to, if it has already occurred, how will it be taken care of. These are what I want to find out, not coming here to read for me. No fatal anyone fatal. There are a lot of fatal this thing for children. There will be something unique about it. It's not true. There was something unique about it. All right, thank you very much for your attention. God bless you. It- you people are just for funny. Are you aware